So pirfenidone and nintedanib are the only two FDA-approved drugs for the treatment of idiopathic pulmonary fibrosis, or IPF. However, there are important limitations with those two drugs. One is the unsustainably high cost of those drugs. Each of those cost about $90,000 per patient per year. The other limitation with those drugs is the modest efficacy of the drug and the disease process in IPF. They only slow down the progression of the disease, but they are unable to stop or reverse the progression of IPF. So patients who are on these drugs still have IPF, and they are still dying from IPF. According to the latest treatment guidelines from major thoracic societies, including the American Thoracic Society, there is a recommendation for the use of proton pump inhibitors, or PPIs, in the treatment of IPF, although the confidence for this recommendation is very low. However, the overall rationale is the accumulated retrospective data that links the use of PPIs with beneficial outcomes, including longer survival and stabilized or improved lung function in those patients. So those are the links that provide a rationale for the potential use of PPIs in IPF. In the last 10 to 12 years, a number of clinical studies that retrospectively evaluated data show that IPF patients who happen to be on PPIs have beneficial outcome, including longer transplant-free survival, stabilized or improved lung function, and fewer IPF-related mortality, and fewer overall mortality, as well as fewer episodes of acute exacerbations. So although retrospective, those are important clinical findings that stimulate interest on the potential use of PPIs in IPF. The proton pump inhibitors are, of course, FDA-approved drugs, primarily for the treatment of gastric acidity. So they have been in the market for about 20 years now. They are generally well tolerated. However, there are inconclusive bioinformatics data that link the use of PPIs with increased risk of respiratory infection. Based on the recommendation of based on the recent treatment guidelines by the thoracic societies, at least the unconflicted members in those societies, as well as based on the accumulated encouraging retrospective data, there is a need to prospectively evaluate the potential beneficial effect of the proton pump inhibitors in patients with IPF. So we need randomized controlled clinical trials that look at the potential benefit of PPIs over time and over dose range, because recent retrospective studies seems to suggest that the beneficial effect of PPIs was associated with the duration of treatment in these patients.